A very unique treatment I want to talk about is night lays. This is an anti-snoring treatment that we apply without any surgery, without any side effects, and the aim is to reduce snoring. Now we know snoring goes hand in hand in most cases with sleep apnea, and both snoring itself, simple snoring, or sleep apnea have very important complications which could cause serious issues with the general health of the patient. Now what snoring is, usually it's a sound that is caused by vibration of the soft tissues at the back of the throat in the airways. So the airway is a tube of soft tissues, and when the tissues are sagging from the top, and if the tube is collapsed, then the walls of the airway goes close to each other, and then when the air is passing through, it just vibrates. And that sound is called snoring. Now, if the air is still going through, it's a less severe situation, but in the cases where actually the airway totally collapses, then it's called apnea. And obstructive sleep apnea causes much more serious issues. So what we need to do is, if you're snoring, first of all, we need to see if we suspect that there is any sleep apnea, and then we will need to discuss with you how we can diagnose that with the help of our medical colleagues. Once we know the diagnosis, then we can treat the situation with a better fit. So what we can do is, depending on the situation again, we could actually just treat the tissues that are collapsing and sagging at the back of the mouth with night lays. So what we do with that is we use photonal lasers to have a special effect where the tissues actually reduce sagging and shrink back up, so they are more healthier and younger. That opens up the airway, which reduces the vibration, so that means the snoring is also reduced. The same effect, the same useful end result can be achieved for the sleep apnea situations, but in those cases sometimes we need an additional step or treatment. That could be a mandibular advancement device where we fix the lower jaw forward with a special appliance, so that's to be worn at night. So that's not the most comfortable thing to wear, but it will open up the airway because the soft tissues are pulled forward, especially the tongue, which actually opens the airway at the back. So if night lays itself is not enough, then we could go for that option. With more severe situations, your ENT doctor or sleep physician can prescribe you a machine that's called CPAP, which is a mask which is connected through a tube to a machine which is plugged in. That is the best thing for snoring and apnea because it actually pushes air in. But obviously it's not the most comfortable thing to sleep with, neither for the patient itself or even the partner, because of the sounds it can make. Now, in addition to these non-invasive options, there is another surgical option which again an ENT doctor would normally prescribe or do. That's where the soft tissues which are sagging and causing the issues are cut off, but the post-operative healing and the amount of pain and the discomfort is usually reported by the patients after that surgery. And it is known that it might come back, all the tissues might again sag down and come back after 3 to 5 years. So that's being done less and less. So in optimal situations, if the patient even is prescribed to have a CPAP machine, and if they cannot wear it, the worst thing they can do is to do nothing about it. The best thing is to have something to open up the airway, and the mandibular advancement device and more comfortably night lays can do that in many cases. Now, why we have this problem can be rooted down to something called a tongue tie, which actually limits the movements of the tongue. Then the tongue is not applying enough pressure in childhood to shape and grow the upper jaw, which then in turn doesn't lead to fully grown nasal space, which then in turn leads to more mouth breathing, because when there is not enough space for the nose to breathe in, then it's easy to open up your mouth and then breathe through the mouth. That then causes more problems, a vicious cycle, because the tongue now is even further away from the palate and it's not applying these forces that the growth actually needs. Then the teeth are actually then inclined inwards. instead of slightly outwards, which even reduces the space for the tongue and pushes the tongue back. So if the tongue is sitting loosely down and not having enough space, obviously when we sleep it can fall back. This same looseness and saggy situation is still present during the day. So many snorers or sleep apnea patients don't breathe well through the day, and they tend to have mouth breathing. And the easier thing for the body to compensate the lack of oxygen and difficulty in breathing is also to bend the head down, which then opens the airway at the back a little bit more. But in this case we don't see what's in front of us, so we tend to do this. So it's down and forward position, which gives this hunchback. So this is another sign of maybe having some sleep apnea issues. Another sign would be clenching your teeth. If you're clenching your teeth, that's usually a reflex to actually open the airway, because when we clench our teeth, the tongue is pushed forward and upward. So the body is trying to get the tongue out of the way. Depending on the severity, it could just go away with the treatments that we do for the snoring. But in severe cases, we could also use masseter Botox to reduce the strength of the biting forces of the muscles, so that the pain and the other complications that's coming with clenching can resolve quicker. But we need to look at the root cause. So we need to check if it's the tongue tie, if it's the teeth, if it's the tongue not having enough space. So we could be talking about orthodontics or tongue tie release or just night lace. It's important to have a personalized diagnosis and treatment plan. At the end of all this, even with some exercises for the tongue and the long-term projects, we are aiming to have a life-changing results. We are aiming to have the patient to wake up and feel refreshed, to heal if they need to heal, if they have inflammation, infection in their body and elsewhere, they need to be healing throughout the night during sleep. So our nutrition, the air we breathe, the water we drink, and our sleep are the most important things for a healthy life, in addition to exercise. So if we don't sleep well, either because it's snoring and we get the elbow from the partner, or it's sleep apnea and we kind of get awakened and aroused, because of the blockage in our airway, we are not sleeping well, we are not breathing well. So it's a good option to start with maybe night lace depending on the situation and go forward in the treatment options. So night lace is, among these options, is the minimally invasive one, the most minimally invasive one, with no side effects and a good success.